Hello, everyone, and thank you for joining this training webinar on California's opioid settlements. My name is Chelsea Kelleher. I'm with Aurora Health Group, and we will be helping DHCS facilitate today's webinar. Next slide, please. During today's webinar, DHCS will be providing background on California's opioid settlements and bankruptcies and their governing agreements. DHCS will also review allowable and unallowable uses of the funds. DHCS will then review reporting requirements and helpful resources on the DHCS OSF webpage. And finally, there will be an opportunity for Q&A with participants. Today's webinar will be recorded and we will be posting it to the DHCS OSF webpage as well. And we will share that link via email with the OSF listserv, which hopefully you are all subscribed to. Next slide, please. This is just a disclaimer that in the event of any discrepancies, the state and national opioid settlement agreements supersede. Next slide, please. And with that, I will turn it over to Jenny Davis from the Department of Healthcare Services, who will walk us through the rest of today's presentation. Jenny is the section chief of the Opioid Settlements Oversight Section for DHCS, which is tasked with overseeing use and reporting of settlement funds among the cities and counties. So I'll turn it over to you, Jenny.
Awesome. Thank you, Chelsea. Hi, everyone. Thank you for joining us today. Today's webinar will act as a bit of a refresher on California's opioid settlements and bankruptcies. If you're new here, today's webinar will be a good starting point for you as we will cover some of the background of the opioid settlements, why California is receiving money from these settlements, why the settlement agreements are fairly strict for most of the funds uses, what those uses are, and what some of the reporting requirements are for those in receipt of those funds. Next slide. So some of our frequently asked questions you can see here. The next few slides will cover the following questions: which settlements and bankruptcies have been finalized in California, and how much money has California received to date from those opioid settlements and bankruptcies? Next slide. California has joined national lawsuits against manufacturers, distributors, and other entities responsible for aiding the opioid epidemic and has begun receiving funds from several opioid judgments. Funds from these settlements are provided to states, cities, and counties through different fund accounts pursuant to the National Opioid Settlement Agreements, the State Subdivision Agreements, and the Mallinckrodt Bankruptcy Plan. To date, California and its cities and counties are receiving funds from 12 different settlements, with more anticipated settlements that are in various stages of their finalization. The 9 you see listed here are the settlements that have previously or are currently paying out funds to California and its cities and counties. You'll see here we have Allergan, CVS, the distributors, Janssen, whose parent company is Johnson & Johnson, Kroger, Mallinckrodt, which is our bankruptcy that we have, Teva, Walgreens, and Walmart. I do want to note that there are no future Mallinckrodt payments planned, so if you're thinking about which funds to spend first, I'd suggest Mallinckrodt, as that will knock some required reporting off your list once those funds have been exhausted. If you are a city or county here that is in receipt of any of these settlement funds from any of these settlements or the bankruptcy, you are required to report on those payments and expenditures to DHCS annually. Not listed here, we do have Publicis, which is an opioid marketing company, and McKinsey, which is an opioid consulting firm. Publicis and McKinsey are both states-only settlements, meaning the state of California has received payments from these settlements for state-directed projects, but no settlement money goes to our cities and counties. Next slide. So I know I just said McKinsey was a states-only settlement, but there are technically 2 McKinsey settlements that have been finalized. The first one makes payments only to the state, but there is one that is making payments to cities and counties. However, excuse me, this McKinsey settlement is not under DHCS oversight, and therefore you are not required to report to DHCS on the receipt and use of those funds. Another one we have is Endo Pharmaceuticals. That's another bankruptcy that has also begun making payments to cities and counties, but this one is also not under DHCS oversight, and therefore you are not required to report to DHCS on those payments nor those uses. Next slide, please. So as of August 2025, California has received over $1.5 billion from these opioid settlements and bankruptcies. This amount does not include the settlements not under DHCS oversight, so this figure is likely a bit higher. Of that 1.5 billion, most funds have been paid directly to our cities and counties for local opioid remediation projects, with the remaining 397 million or 25% being paid directly to the state of California. Next slide. So the Department of Healthcare Services has been named as the oversight entity for California's opioid settlement funds. This authority comes from the state subdivision agreement, which we will talk about in future slides. These responsibilities include monitoring our cities and counties for compliance with the applicable settlement agreements, most notably the use and requirements of those received funds, designating additional high-impact abatement activities. Our state subdivision agreements came with 5 high-impact abatement activities. In 2023, we did add a 6th high-impact abatement activity, which we will talk more about soon. DHCS is responsible for conducting related stakeholder engagement and also preparing annual reports. A common misconception that we see is that DHCS is involved in the payment distribution for cities and counties, but that's not true. All payments come directly from either Brown Greer PLC, who is the directing administrator for the settlement, or the National Opioid Abatement Trust, or NOAT2 for short, for the Mallinckrodt bankruptcy. Next slide. Okay, so as promised, we'll go over a little bit about the state subdivision agreements. In California, each settlement does have both a national settlement agreement and a state subdivision agreement. The state subdivision agreement provides additional requirements and are specific to the state of California. Next slide. The next few slides will talk about the allocation or funding split between the state and its cities and counties, as well as distribution of funds. We'll also talk a little bit more about administrative expenses as they pertain to cities and counties. Next slide. So as national agreements were finalized, states and their subdivisions had the ability to structure settlement allocations according to their preferences. The state of California and its council representing cities and counties reached an agreement to define the allocations and uses of payments from the national opioid settlements. These agreements, referred to as the state subdivision agreements, govern allocations and expenditures in California. These agreements are formally accepted and adopted by California cities and counties through the sign-on process. As a note, cities may opt out of receiving direct payments each year after they have signed on to a specific settlement, as long as they contact Brown Greer within more than 60 days of the next payment date. Otherwise, if that payment is still received, cities do have the option of reallocating those funds, although they will still be required to report on that reallocation on DHCS's annual report. Next slide. So here's a graph that shows you the distribution of funds. For the settlements, the opioid defendant is any of the settlements we showed previously. So that's Allergan, CVS, etc. They're the ones that make payments directly to Brown Greer PLC, who then distributes those payments based on those 3 fund types. You'll see we have the California State Fund, the California Abatement Accounts Fund, and the California Subdivision Fund, and we'll go over those funds in more detail on a future slide. Next slide. So here is the division of funds for our settlements. This table is based off of the information provided in those state subdivision agreements. California has decided to separate its allocations in funds this way. 15% goes to the state of California to be used for state-directed projects. This money is subject to normal budgetary and legislative processes and is ultimately appropriated in the state budget to specific state departments for opioid remediation projects. The Department of Healthcare Services and the California Department of Public Health are common recipients based on our respective departments' works in opioid remediation, but we've also seen appropriations made to the Department of Rehabilitation and the Department of Healthcare Access and Information. If you want more information on these projects funded by opioid settlement funds, we do have descriptions for each on our California Opioid Response webpage. The rest of the funds, or 85%, go directly to cities and counties. The largest fund is the Abatement Accounts Fund. This fund is restricted to uses in Exhibit E, which is the list of California's eligible opioid remediation uses. Additionally, these funds are subject to no less than 50% of them received in a calendar year being spent on one or more high-impact abatement activity, and I promise we will get there to discuss high-impact abatement activities in more detail. And finally, we have our California Subdivision Fund. This is money that goes directly to plaintiff subdivisions who are involved in the initial litigation for these opioid settlements. These funds must be used for future opioid remediation activities and to reimburse past opioid-related expenses, which can include litigation fees and expenses incurred against any opioid defendant in the national settlements. Next slide, please. Here are the same funds, but a little information on how to think about these funds. The state fund essentially goes to state departments for bigger statewide projects. A notable one is our naloxone distribution project in California, which has received settlement funding in the past. There's also a small chunk dedicated through the budget each year for DHCS oversight staff and opioid oversight resources. The Abatement Accounts Fund is the biggest and specifically restricted to opioid remediation projects listed in Exhibit E. And the Subdivision Fund is small, but a bit more flexible in its opioid remediation uses. It's not restricted to Exhibit E, and it does not adhere to the HIAA or High Impact Abatement Activity 50% threshold. Next slide. So these are our current settlements that follow this structure. There are more that will follow, and those settlements will almost certainly follow this structure. Absent is Mallinckrodt, as that is our bankruptcy, and although shares many similarities with the settlements, the allocation structure is different, and we'll see that on a future slide. Next slide, please. So the answer is yes, cities and counties may use their opioid settlement funds for administrative costs. The national settlement agreements state that they must be reasonable and related. DHCS has a reasonable administrative cost policy published that goes further into the details, but basically anything up to 10% of the total amount allocated to a specific and eligible opioid project is deemed reasonable. Anything above that is subject to further review. Next slide, please. If you would like to know more about payments that have been distributed, DHCS does maintain a list on our California Opioid Settlements webpage. These numbers are provided directly from Brown Greer and NOAT 2. Right now, I think it's current as of June 2025, but we are in the process of finalizing a new payment list that will reflect payments received in the past 6 months. We do update this fairly frequently, so check back to see if you would like additional payments being made. Oh, thank you, Chelsea. The next couple of slides will cover Mallinckrodt specifically, as that is our only current bankruptcy that is under DHCS oversight. As a note, and I'll say this probably throughout the webinar numerous times, Endo, although a bankruptcy, does not have reporting requirements to DHCS, so we will not be covering those in this webinar. Next slide. So similar to the settlements, Mallinckrodt has its own set of governing documents. These payments are not expected to continue as they have filed an additional bankruptcy, but if any city or county is still holding on to those funds, they will need to be spent accordingly. Instead of Brown Greer making their payments, they do have a trust, NOAT 2, making their payments. We also want to note that Mallinckrodt payments are linked to the distributor national settlement agreement. So depending on your status in that settlement, that will reflect your Mallinckrodt opt-in status. If a city did not elect direct payment in that national distributor settlement, then the funds will be distributed to the county in which that city is located. Next slide, please. Here's another visual representation of the distribution of funds and how they make their way to the cities and counties. It starts with Mallinckrodt making their payments to National Opioid Abatement Trust, NOAT2, and then NOAT2 makes the payments to the state of California or its local governments or the cities and counties that are receiving Mallinckrodt payments. So similar to the fund types and the settlements, which we had those three different fund types, Mallinckrodt does have two what we call shares. So we have the state share as well as the local government share. Next slide. Here's Mallinckrodt's division of funds. Similar, but notably different from the settlements. So they have their state share, which goes directly to the state of California for state-directed programs. That is 40%. And then we have our local government share, which is 60% that goes directly to the cities and counties. These funds must be used for future opioid remediation in one or more of the opioid remediation activities listed in Exhibit 4 of the Mallinckrodt bankruptcy plan, but this is identical to Exhibit E of the National Opioid Settlement Agreements. Next slide, please. The state share is subject to normal budgetary processes in California and is used for larger scale projects, and the local government share is for more local opioid remediation projects. These shares are basically the same as the state fund and the abatement accounts fund from the settlements, with one notable exception. Next slide. And that is the administrative costs that Mallinckrodt allows. They are restricted to 5% of the total allocation, and this is outlined in the statewide abatement agreement. Next slide, please. So next we will discuss a little bit about the allowable and unallowable uses of funds. This could be a webinar in and of itself, but we'll try to give you the key highlights here. Next slide. Here are the frequently asked questions we'll be going over. Are there requirements for how cities and counties can spend these funds? What is a high impact abatement activity? And what happens if a city or county expends funds on an unallowable activity? Next slide, please. So we'll start from the beginning. And those are the lessons that were learned from the Tobacco Master Settlement Agreement. So Exhibit E can be viewed as a result of this Master Settlement Agreement from the 1990s. Critics of the Tobacco Master Settlement Agreement mention that while states continue to collect substantial funds from these settlements, only a small fraction of those funds have been historically used on smoking prevention and cessation programs due to the lack of fund restrictions. And I'll briefly pause. I know there's a lot on here, but this is a graphic that basically shows what percentage the states are spending on smoking prevention. Next slide. So what did California learn? We learned to clearly identify and define allowable uses for these funds. This ensures the opioid defendants in these settlement agreements are making payments towards alleviating the devastating effects of the opioid crisis that they helped fuel. The National Opioid Settlement Agreements define opioid remediation as the care, treatment, and other programs and expenditures designed to address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, or mitigate other alleged effects of, including on those injured as a result of the opioid epidemic. So you can consider Exhibit E our way of preventing what we saw happen for the tobacco settlements. Next slide, please. The Abatement Accounts Fund. This is the fund. I know we've talked a lot about Exhibit E already, but again, this is the list of allowable opioid remediation uses. It's broken out into Schedule A and Schedule B. Schedule A is a list of core strategies, which are activities that should be prioritized. And Schedule B is the list of approved uses, which is a comprehensive list of the eligible opioid remediation activities that cities and counties can opt to use. If you are a city or county here that does report to DHCS, you'll know that the reporting form does only allow you to choose an option from Schedule B, but that's because we've identified activities from Schedule A that correlate to Schedule B. So don't worry, you're not reporting incorrectly. For Mallinckrodt reporting, we do allow cities and counties to choose Schedule A because we report on behalf of you to NOAT 2, and that's how their process is set up. Next slide, please. All right, California's high impact abatement activities. So for those of you here that are in receipt of abatement accounts funds, you will need to strategize and make sure you are able to meet that 50% requirement for those funds. This is a requirement from the state subdivision agreements. If you are unsure about how to meet this requirement, we have excellent staff that can assist. If you fill out a technical assistance form, we have resources at the end of this presentation that will tell you how to do that. Next slide, please. So here is our list of California's high impact abatement activities. The first 5 can be found in the state subdivision agreements, but the 6th was added by DHCS in 2023. Some state subdivision agreements that came after we designated this 6th high impact abatement activity may have that one included, but regardless of the settlement finalization date, the 6th activity is an eligible HIAA activity for all of our settlements. So our first high impact abatement activity is related to our BCHIP program. It's the provision of matching funds or operating costs for substance use disorder facilities within approved project within BCHIP. One thing I want to note is that if you do claim this one during annual reporting, we will request the BCHIP award letter to verify that it is 1, a SUD facility, and 2, in the BCHIP program. Our second one is creating new or expanded substance use disorder treatment infrastructure. This can be programmatic or physical. Number 3 is addressing the needs of communities of color and vulnerable populations, including sheltered and unsheltered populations that are disproportionately impacted by SUD. We do go into a definition of vulnerable populations a little bit more in our behavioral health information notices, so I suggest taking a look at those. We have them linked at the end of this presentation. Number 4 is diversion of people with SUD from the justice system into treatment, including by providing training and resources to first and early responders, and implementing best practices for outreach, diversion, and deflection, employability, restorative justice, and harm reduction. Number 5 is interventions to prevent drug addiction in vulnerable youth. This is also expanded on in our bins. And number 6 are new. I'm going to air quote new. It's been around for a little bit now, but it's the purchase of naloxone for distribution and efforts to expand access to naloxone for opioid overdose reversals. Next slide, please. The California Subdivision Fund. Unlike the Abatement Accounts Fund, the Subdivision Fund is not restricted to Exhibit E, but instead must meet that definition of opioid remediation that we saw on a previous slide. Subdivision funds can be used on future opioid remediation projects or to reimburse past opioid remediation projects. And that can include fees and expenses related to litigation against any opioid defendant from the national agreements. Next slide, please. Here are some key definitions if you are a plaintiff subdivision that you may want to make yourself aware of. The first is backstop funds. Plaintiff subdivisions may choose to withhold funds from their subdivision fund payments to pay their contingency fee counsel. These payments are made directly to the contingency fee counsel. And as a note here, as a plaintiff subdivision, you may opt to have backstop funds withheld. And if so, you do not need to report on those funds when they are withheld. However, when that payment does go out to the contingency fee counsel, that is a reportable payment to DHCS. Our staff has reached out and is working directly with those identified as receiving backstop payments. And so if you have not been reached out to, you probably did not receive a backstop payment. The next is awarded costs. These are similar, but these are reasonable payments to city or county attorneys and their staff who are employed by the plaintiff subdivision for time spent litigating the opioid settlements. And I see we have a note here that says if plaintiff subdivisions dedicate funds to past opioid-related expenses, including litigation costs, these expenses must be reported to Brown Greer via a reporting portal. So basically, if you are reimbursing past litigation or legal costs, you do need to report that to Brown Greer. Next slide, please. We do get asked quite a bit from our cities and counties how to identify if they are a plaintiff subdivision. The easiest way I think to do that would be to go to our payment list, which we do have on our DHCS website. Check for your city or county name and see if you have received any payments from what is highlighted here as the subdivision fund. That will tell you that you are in receipt of subdivision funds and therefore a plaintiff subdivision. You can also reach out to us and we can see if we can further clarify any information for you on that. Next slide, please. So unallowable uses of funds. These are activities that are not allowable, and this includes, but I will say this is not a comprehensive list, but it does include administrative costs that are not reasonable or beyond 10%, costs that pay the salaries or benefits of individuals that are not performing opioid remediation activities, paying for non-FDA approved medications, medical services, or services not related to treatment of substance use disorders or mental health conditions, or developing infrastructure or investing in equipment not directly related to prevention, treatment, or recovery services, or other expenses not directly related to opioid remediation activities. Again, this is not an exhaustive list. We do expand on this a little bit in our behavioral health information notices. We also have a resource specific to first responders and law enforcement for unallowable purchases. That is available on our webpage as well. If DHCS determines that a participating subdivision's use of abatement accounts funds is inconsistent with eligible uses, records may be requested as part of a meet and confer, an audit, or legal action. Next slide, please. So if you'd like to know more about our allowable expenditures and our high impact abatement activities, this is where you can find that information on our webpage. If you'd like to find Exhibit E, it looks like it is linked there. That'll take you directly to the list of eligible opioid remediation uses. Next slide, please. Okay, so next we will talk about DHCS reporting requirements. Next slide. Frequently asked questions we get are, what are the reporting requirements for these funds? And how can I see how other cities and counties are spending their funds? Oh, thank you, Chelsea. Cities and counties receiving funds from the opioid settlements and bankruptcies are required to complete annual reporting to DHCS. We've created an annual reporting form for cities and counties to meet this requirement. Cities and counties report on payments received and expenditures during the state fiscal year, which runs from July 1st to June 30th. Reporting is not required for the McKinsey settlement or the Endo bankruptcy. Annually, the DHCS team will host a webinar to preview the reporting form and any changes, if any, were made from the previous form. The reporting form is typically open from July 1st to September 30th. Next slide, please. After we receive the cities and counties submitted reports, DHCS does use that information to then craft our annual report. Per the California State Subdivision Agreements, we are required to prepare this annual report regarding the state's use of funds from those settlements until those funds are fully expended and for 1 year thereafter. These reports are made publicly available on our DHCS website, and we host a public meeting to discuss the report and the findings, including the opioid remediation activities being carried out by both the state and our participating subdivisions, which are cities and counties in receipt of settlement funds. I will say currently this webpage is under maintenance. So if we send this out and that link does not work, just check back later. They will be up shortly. Next slide, please. Here's how you can find that. Oh, sorry, reporting requirements. Yes, if you'd like to know more about the reporting requirements, we do have a tab for that as well. That goes over the information that you're likely looking for. Next slide, please. Okay, on to resources. Thank you. Next slide. So some of the frequently asked questions that we'll be going over here. What are the best practices for allocating settlement funds? How do we request technical assistance? And where can I find additional opioid settlement resources? Next slide. So we've had many conversations with folks of various backgrounds and have kind of created some short information for best practices for allocating these funds. So we suggest when allocating funds, cities and counties should consider one, investing in evidence-based practices with a focus on those listed in California's high impacted abatement activities and the core strategies, which are Schedule A of Exhibit E. At this point, we know what works for opioid remediation. There's plenty of literature out there that outlines what activities help retention and treatment and recovery. We suggest utilizing those resources. Number two, supplementing current successful efforts. No need to reconstruct. There are plenty of efforts out there that can be supplemented with opioid settlement funding. You can typically reach out to any local opioid coalition, public health departments. I'm sure that they would have numerous efforts that could be supplemented. And three, creating a transparent process for planning, including engaging people with lived experience and people working in SUD prevention, treatment, harm reduction, and recovery to understand community needs. Again, we've had many conversations with folks looking for information on how to get into contact with the people who are in receipt of those settlement funds, and they would be an excellent resource if anyone is stuck on how to spend the money that they have received. There are plenty of people that will have great ideas for you. Next slide. So evidence-based strategies, most of Exhibit E activities do require the activity is evidence-based or evidence-informed. There's a substantial body of evidence demonstrating successful interventions for opioid use disorder. Participating subdivisions should use this information to make their funding decisions. For example, medications for opioid use disorder or medications for addiction treatment are proven to increase retention and treatment and reduce the risk of overdose. Strategies for treatment should include organizations or treatment providers that provide or endorse this use. Here are some links for best practice resources that can help you identify evidence-based strategies. Next slide, please. Another thing we suggest, definitely prioritize core strategies in the HIAA. Again, the high impact abatement activities, if you are using your abatement accounts, funds do need to be spent at least 50% on one or more of our activities that are categorized as HIAA. Core strategies can be found in Exhibit E and also our allowable expenses resource. And again, make sure that you're spending at least 50% of those abatement accounts funds on high impact abatement activities. Many activities outlined within Exhibit E can qualify as a high impact abatement activity depending on their focus. And if you are unsure if your activity does or does not meet an HIAA category, you can always submit a technical assistance form to send to us, and we will review and let you know if it appears to be eligible for that HIAA category. Next slide, please. We suggest leveraging existing community capacity, so focus on strengthening and expanding current opioid remediation efforts rather than creating new programs. Look for organizations already doing opioid remediation work in your jurisdiction and connect with them to learn about their needs. There are plenty of local entities who are likely already working on projects that would be eligible for settlement funds, not only including county public health departments, county behavioral health departments, harm reduction programs or syringe service programs, local opioid coalitions, local SUD treatment providers, and local hospitals and clinics. Next slide, please. Have a transparent process. We suggest you invite individuals with lived experience to participate in planning discussions or allocate a set number of seats on planning councils for individuals that have lived experience. Seek out input from a wide variety of groups during planning, including experts in SUD treatment, organizations working directly with youth and people who use drugs, law enforcement personnel, recovery community organizations, and social service organizations. In addition, include any city or county departments who may provide services in accordance with the opioid remediation activities outlined in Exhibit E and categorized under California's high impact abatement activities. We suggest soliciting input from the public to help raise the profile of the plans and give those community members with unique perspectives the opportunity to provide feedback. Next slide, please. Requesting technical assistance. So if you haven't already or you're new here, we do offer technical assistance to all participating subdivisions interested in reviewing eligible opioid remediation activities, expense tracking, and reporting requirements under the California opioid settlements. You can visit the resources and technical assistance tab on the DHCS opioid settlements webpage. There will be a form that you will fill out with any information pertaining to your activity that you would like for us to review. And then someone from the opioid settlements DHCS team will get back to you after reviewing the information you have provided. Next slide. Guidance letters to cities and counties. We do have a robust amount of resources available on our DHCS webpage. In January 2024, we released 2 guidance letters to participating subdivisions. These are our behavioral health information notices. Cities and counties should refer to these documents for the current policies related to allowable uses and reporting requirements for the Abatement Accounts Fund and the Subdivision Fund. Below are some links along with enclosures. So we have a reasonable administrative cost policy for the Abatement Accounts Fund, and we do also have glossaries. I will say we are quite close to finalizing an update to these bins. So be on the lookout. I'm sure we'll send out some correspondence letting you all know when they are final and published onto our DHCS webpage, as they will include updates and clarification essentially for the California opioid settlements. Next slide, please. Here is how you can navigate to the resources and technical assistance page. We can't scroll on here, but if you do go to the page under resources, fact sheets, FAQs, you'll see numerous links to various documents that will help if you are in need of clarification for any sort of reporting requirement or allowable uses or unallowable uses. I'd wager that you can find most information here that can answer any questions that you may have. And if not, then again, you can submit a TA request form to our staff to review. Next slide. This is a new resource that we have finished creating based on feedback actually from our cities and counties. This is our California Opioid Settlement and Bankruptcy Overview. So what we tried to do here is take all of the just complicated and legal information that pertains to these settlements and tried to make it a bit more digestible and easy to read. So we picked out some of the key information. So in case you don't want to read hundreds of pages of any legal document, if you don't even want to read 10 pages of one of our resources, you can look at this one. And it should contain most of the high-level information pertaining to who the settlement administrator is, what the reporting required is, expenditure requirements, if there's an HIAA requirement, administrative cost. It's a good resource to have at your disposal, and a quick, easy reference guide. So that will be available shortly, if not already on our webpage. Next slide. Here is a QR code that will lead you to our DHCS opioid settlement website. It's also linked here, so when you receive this presentation, you can go ahead and click there. All the tabs that we showed throughout the presentation are on this webpage linked here. Next slide, please. And I think that's when I turn it back over to Chelsea.
Great, thank you, Jenny. So now we have about 20 minutes left in the webinar for Q&A with participants. You can either submit your questions in the Q&A box, or you can raise your hand and we will ask you to unmute. I see that we do have a few questions in the Q&A box, so we'll start there while folks put their hands up if they'd like to ask their question verbally. So we'll start with a question here from WeBang. We received a Special Master Award of Subdivision Costs July 31st, 2024 under Distributor 4. Can you provide a link on the DHCS website about details of this award and its allowable uses? The DHCS analyst indicated it is not part of the abatement or subdivision accounts fund and not to be used for opioid abatement. So think Jenny, maybe a little bit more information about these special master award of subdivision costs.
Yeah, thank you, Chelsea. Yeah, so the special master is if my memory serves, a retired judicial appointee or former lawyer who is not currently employed or retained by a plaintiff subdivision. And that person's job, and there is an individual filling this role and has been for quite some years, is to aggregate and check the reasonable awarded costs that come in that cities and counties can request for reimbursement. They are noted on our webpage. They are reportable onto our annual reporting form. They are essentially reimbursements for city and county attorneys that were working on the opioid litigation for your city or county. And if you want some help regarding how to report that, I'd reach back out to your analyst and they can help out with that.
Great, thank you, Jenny. So another question from Matt Pressey. For cities to confirm, can we spend 10% on administration and another 5% on indirect costs? So I think looking for a little clarification there about the 10% versus 5%, and when DHCS is talking about administrative versus indirect costs.
Yeah, so I think if I'm understanding correctly, the 10% is related to the settlements and the 5% is related to the Mallinckrodt bankruptcy. So if you have an activity that is usually using those funds, you will need to make sure that you are not going over that 10 or that 5% respectively. Indirect costs, we do go over a bit more in detail. We have a reasonable administrative cost policy document. These are basically costs that aren't considered direct costs, but they still may be incurred during the kind of lifespan of your project or program that you are implementing. So they're not directly attributable to a direct cost, and that can include potentially staff that are not only working on opioid remediation, it could be various types of insurance. There's plenty of different types that could be considered indirect. But I think the crux of the question is how much is allowed to be spent on those indirect or administrative costs. And so you will need to check which settlement or bankruptcy funding you are using, and just make sure that the 5% is not exceeded for your Mallinckrodt funds and the 10% is not exceeded for your settlement funds. I hope that answers your question if I understood correctly.
If I could add to that too, is on the DHCS opioid settlement funds webpage. We have a link to behavioral health information notices, which are the way that Department of Healthcare Services establishes policy, basically. And there is a reasonable administrative costs policy that sort of sparses out the difference between indirect and direct cost. Those indirect costs are, of course, like shared building space or, maybe utilities or, it just depends on the actual expense, where those direct costs really are those costs that are directly attributable to an opioid remediation activity. But any further questions, again, like I said, that reasonable administrative cost policy is on our website. And, after you read through that, if you have any more questions specifically about that, our team's willing to support with that.
Great. Thank you, Sandy. Another question we will turn to from Natalia Flores. How long after submitting the reporting form will we hear back confirming that all of our reported uses were confirmed as approved allowable uses?
That's an excellent question. There might be, it depends. When we get these forms, depending on how they come to us, there could be a large batch that comes at once. And so you may see a little bit longer of a wait time to have your analyst reach out to you about those expenses reported on that form. But our analysts do reach out to everyone directly who does submit a form. Typically, if they are easier to confirm payments and expenditures on, you'll probably hear from them a bit quicker. But if you have any questions in the meantime, or if you want to be sure that you are reporting correctly, you can submit a TA form or reach out directly to the analyst that has reached out in the past to you about your reporting form. And I'm sorry, I don't have a better answer for a turnaround time, but there are hundreds of these reports that we typically receive at once. And so it really just depends on what information is on there. For example, if you have expenditures that are kind of ongoing projects that we saw on a previous report, it'll be easier for us to confirm that that is an eligible use versus a new project that we haven't reviewed before. It also depends on how many activities you have on there. Sometimes we see reports that have one, and sometimes we see reports that have 20 or more. So obviously, depending on how many activities you have in any fiscal year and how much money was spent on them, then you could see potentially a longer time between that submission and then also your analyst reaching out to you. But again, I just want to clarify that you can reach out to your analyst or the DHCS inbox with the TA reform at any point, whether you've submitted a report or not.
And I'll add to that too. Again, this is Sandy. Is as long as if you're using that 70% abatement accounts fund, as long as you're utilizing those funds for an activity that's specifically listed in Exhibit E, you're more likely to get that report moving faster, because that's, I think, where we get most of our hiccups, is where we see reported uses that are outside of what's considered allowable for that abatement accounts fund. And also taking into consideration that 50% of those funds must be spent on a high impact abatement activity that has an Exhibit E qualifier. Again, our staff can walk you through that as well. But I think that's one thing that's really helpful, is just making sure that you're using Exhibit E as your guide. And that would be the same for Mallinckrodt as well. Utilizing that Exhibit E and focusing your activities and your projects on those activities specifically listed there. That will support with moving those reports much faster. Another thing is each reporting cycle. So we do reporting on a fiscal year, and then we open the report on July 1st, and reporting goes through September 30th. If you're on our distribution list, our team does like reporting kind of open hours per se. And so that information is sent out at the end of June, beginning of July, when those office hours will be, and it allows you to come on and talk about hear a little bit more about the reporting, but also just ask direct questions to ensure that you're getting accurate reporting that first time.
Great, thank you both. I just want to note that we had a bit of a glitch with the hand raise option. So if anyone wasn't able to raise their hands and you still want to, please go ahead and do so. That should be working now, and we can unmute you. I'll go to one more question first. And Juan Hernandez asks, is there a time limitation to use these funds received?
That's an excellent question. Yes, there are time restrictions found in our governing documents. So for the settlements, the abatement accounts fund specifically, they are generally the time frame is 5 years from the date of payment. If you're doing a capital outlay project, that is increased to 7 years. For the subdivision funds, I don't recall that there is a time frame to spend those, but we do recommend you spend them, not sit on them, just because opioid remediation projects, these funds are meant to be spent currently to abate the current crisis that we are in. But yes, to answer your question shortly, there are timeframes for the abatement accounts fund, which generally the time frame is 5 years.
Great, and we have Nadia Martinez has her hand raised, so I'll ask her to unmute.
Hi, thank you for taking my question. My question regards to the not allowable uses. If we have an activity that we're funding that is allowable, but components of that activity require the use of items that are not allowed, can we then purchase them? Let me give you an example. We have a program where we send people to treatment or for co-occurring mental health issues for stabilization. But because it is not a hospital level acuity treatment center, the participants or the clients need to be cleared for any medical conditions before they go there. So in order to do that, we have to be able to stabilize specific conditions or test or treats for specific things prior to sending somebody there to make sure that they're not going to have a heart attack or some sort of medical emergency while they are at that facility. So at that point, does specific equipment then become available? Because it's not specific for treating SUD in a normal sense, but it's a required component of that program, and the need for that equipment would not be there were we not running this activity.
Thank you. Yeah, that's a good question. I would think that is a good example of what could be considered an indirect cost, but I'll caveat that and say I would suggest filling out a technical assistance form just so we can take a look at all of the information you can provide to make that determination. But as you have described, it does sound like that would be an indirect cost, especially if it would be a requirement of the opioid remediation activity, the larger project that you are implementing. But to make sure that I'm giving you accurate information here, I would recommend submitting a TA request form.
So would that also not be allowable under the subdivision that are not subject to exhibiting if we choose to use those funds?
That's true. Yes, the subdivision funds are less restrictive in their uses.
So then if we strictly purchase those equipment or that equipment or a set of medications, then as long as we report it as such, then it becomes an allowable use under those, right?
I think
So
it's,
go ahead.
I was just going to say, I think it's difficult when we hear things like sets of medications or equipment without having specific information on our webpage. Again, I know we keep talking about our webpage, but we do have a list of purchases that we don't consider to be allowable, like gloves and, a variety of different things. We also have some policy that only allows for FDA approved medications specific to the treatment of substance use disorders. So I think the question is a little general. It is common for individuals who are accessing treatment facilities, including residential stays in a detox or residential treatment program, are required to have some level of a health screening. Sometimes that happens once they're within the treatment or once they're without or prior to admission to the treatment. So I think it would just depend on what type of equipment that we're talking about, because most of the time what we're seeing is treatment providers are usually coordinating with a primary care physician or some type of a medical physician to have those screenings done. So I think unless we would have specific information on the type of project that you're talking about and what type of equipment or sets of medications you're referencing to, I think it's difficult for us to respond to that. But yes, the subdivision funds tend to be another option to support those opioid remediation activities. But just a reminder that those opioid remediation or the subdivision funds must also be used for opioid remediation. So I think maybe just having a specific conversation directly with DHCS so we can be really clear before we could answer on a general webinar.
Thank you, Sandy. That really clarifies the question because it's our advanced provider response unit who is the medical provider that is doing the clearance. So we're not going to a third party. We're creating that unit. But thank you. That's really helpful. And I will submit a ticket if there's any other questions.
That's great. We look forward to it. Thank you.
Mhm.
All right, we will go to another question. I'll pair these two together. Um, Robin Stebbins asks, why are the McKinsey and Endo settlements not under DHCS? And Matt Lethan asks, for McKinsey and Endo, since they are not under DHCS oversight, are they also restricted to Exhibit E?
So for Endo and McKinsey, that's just how those settlement agreements were drafted by those lawyers working on that litigation. They just did not include any DHCS oversight into those settlement agreements. I would suggest going directly to those agreement documents and checking to see what those requirements are in those documents. For Endo specifically, I know you can find that agreement, I believe, on the Attorney General's webpage for California. They have a list of all documents, actually, including all the national settlement agreements and the state subdivision agreements. And you can find endos on there as well. You may need to do a little bit of a search for the McKinsey settlements, as I don't believe they are listed on there. But that is what I would suggest, is going back to those settlement documents and checking to see what those use requirements are.
I'm going to keep jumping in here. So sorry. I feel like the peanut gallery over here. We did just develop a DHCS sort of opioid settlement overview document, and that document will be posted on our webpage here, hopefully by the end of the day. It was a result of communication and a survey conducted with stakeholders as one of those items that would be helpful in helping cities and counties understand the opioid settlements. And that document will have a link to those respective documents. And I can say that those funds still need to be used for opioid remediation. Indo is a little bit more specific in the sense that it says that the activities must be closely aligned, basically, with those activities listed in Exhibit E. But like Jenny mentioned, going to our webpage later this afternoon, there are links to those agreements so that you can get more specificity. But again, they are required to be used for opioid remediation.
Thank you both. I know we're just about at the end of time. I think we can probably take one or two more questions. I'll pair another couple of questions that came in related to accessing resources. So Tara Davis asks, I'm new with my county. Do I need a login to the DHCS opioid website for reporting? And Vanessa Esperza asks, how can I be added to the distribution list? And I'll answer that second one. The Aurora team will help send out an email after this webinar with links to the documents that we mentioned today, as well as the recording. And so that has a sign up page. We can also share that in the chat here so that you can add yourself to our mailing list. And then DHCS team, do you want to take the question about whether login is needed for your website?
Yeah, for our resources on our DHCS website, no, they're publicly available. You do not need a login to access that.
And when we send out the slides after this presentation, at the end of the slides, there's a QR code which takes you to the DHCS California Opioid Settlements webpage. It has a plethora of information, so happy reading.
Great. Well, thank you all very much for joining us today. As I mentioned, all of the information covered here will be shared after the webinar to that participating subdivision mailing list that you should all be on or have the option to join if you would like. We will be sending that out. And as a further reminder, we'll be doing more of these 101 type webinars. That was also based on feedback that the DHCS team received. So there will be future opportunities for you to see this webinar or recommend it to other members of your staff who may be newly joining. So we will have future opportunities for these as well. And with that, I want to thank you all for joining today and have a wonderful rest of your day.